So now, as we are already in the response, we are going to discuss what are the measures or what are the activities that we do so that we limit the spread, but also we take care of the positive cases identified. So we must always try to get the case as early as possible. We must identify how we do identified or expired. We must be careful always to remove personal items before putting on PPEs because jewelries, watches, cell phones, they are key items that can spread the infection very, very fast. But also most of the jewelry and what they destroy the PPE the time you are putting on or removing on. So for ladies, most of the time who have long hairs, they must be tied and then a head cover must be put on. Scrubs should be worn. There are some people who find they worn PPE on their own clothes. It is not good. Rubber boots should be worn. If not available, we can put the shoes that are cross the two with the shoe cover. And always remember hand hygiene before putting on PPE. Never use tape to secure PPE in place. Even that area of the zip at the coverall, we do not have to put that tape there because it causes difficult during removal. So these are the posters we found at area of donning when we have coverall. And here we have when there are the steps to put on full PPE when we don't have coverall, when we use the gown and the apron. So when it comes to removal of PPE, the practice of spraying on human is highly discouraged. So no person should be sprayed with disinfectant solution, including spraying of foot or boots, spraying during PPE removal, use of disinfectant in showers, spraying disinfectant in any setting where humans are present. Why? Because the spraying of this chlorine, which is the common disinfectant we are using, is irritant to the skin, eyes, and the respiratory tract. Spraying may be regarded as unacceptable because it is not tolerated by many people. People doing the donning and doffing must be trained so that they can use PPE appropriately. But also, once the healthcare personnel or the cleaner is performing any procedure in isolation and the PPE become heavily dirty, they can come out and then put on again rather than continuing with heavily contaminated PPEs. Another reason not to spray the disinfectant, because spraying disinfectant on organic material, they activate the disinfectant and then to become ineffective. So during removal of PPE is the critical moment for healthcare workers because it is the source of self-contamination. Therefore, training is necessary on how to use the PPE and body should be there. So always remember that mucous membrane protection are removed after other PPEs. So these are again the steps for removal which should be present in isolation and the area of removal of the PPEs. So far, now we go to the cleaning and disinfection in the context of Marburg. I try to go a bit faster. So we have different surfaces in the hospital and the effectiveness of our cleaning and disinfection depend on the type of surface, the temperature, and the presence or absence of body fluid, including blood. So when we talk about the surface, we have the porous and non-porous area. For a small surface is easy to clean compared to this porous area where we can have vomit formation in these pores. And then About the temperature and humidity, Ebola virus can survive longer in low humidity, low temperature setting. And then the presence or the absence of body fluid, for example, in case of too much of body fluid, if they are not removed, they are going to cause the activation of the disinfectant. So we found that the Ebola virus, because this is where we have data, it can stay in the wastewater around 24 hours, but it can be destroyed by the disinfectant that we have. Another thing is the Ebola virus can survive up to 16 days in a dried organic substance on a non-porous surface. So that's why you do not have to leave the space without cleaning and disinfection, because the virus may be surviving in those areas. So, however, using the cleaning and disinfectant effectively is going to remove the virus. So the principle of cleaning, because in our setting we use the separate substance, we have detergent separated from disinfectant. Therefore, we have always to do cleaning before applying a disinfectant. We use detergent and water, and then we apply the disinfectant after. It is recommended to use wiping method over spraying, because spraying risks to cause aerosol generation, which can lead to airborne transmission, while the disease was just contact transmission. Therefore, wiping not only is preferable because it prevents the aerosol generation, but also it provides also mechanical action, the friction, that is going to increase the removal of soil and microorganisms on the surface. When we are cleaning, we have to start we have to have a concentration on what we call high touch area. We have, for example, the knobs, the sink, the handrail of the beds. These are the high touch, the area we like to touch whenever we are entering into the room of the patient. And then we have to approach the cleaning from the cleaner area to the dirtier area, from the higher level to the lower level, and use a one direction, like clockwise or anti-clockwise direction. And another component in cleaning and decontamination is the contact time of the disinfectant to the surface you want to disinfect. We are going to see the time required. So when we talk about high touch area, for example, this is operating theater or a procedure room. The high touch area here are identified. These are the area we like to touch. This is a cupboard, and then here is the light up. Here is the where we do this, like the sink, where we open our sterilized material. For example, here is the tray. We like to touch here while we are pushing or bringing it up. Here it is on the bed where we like to touch when we want to level up or put the bed on the level we want. So these are the high touch area where we have to put too much of emphasis. And to make sure that we have cleaned those areas, we need to have a supervision, but also a checklist of these areas so that we do not miss these areas while we are doing cleaning and decontamination. So the steps, this is to help you to have a organized mind when we are requested to go to clean. We have to prepare equipment first. We have to prepare the chlorinated water as well as the detergent water. We have to perform hand hygiene and then put on PPE. We have to remove contaminated waste and then perform cleaning, followed by decontamination, dispose of the contaminated item, and then remove PPE. So in this presentation, we try to put more detail about what is required at each step. But as we are going to share the presentation, I think everyone may go through And then next time we can have discussion whenever we have a problem. These are the PPE for cleaners. You are going to see that it is full PPE, but at the level of the apron, we have to put waterproof heavy-duty apron. And for the gloves, the outer glove must be the heavy-duty glove. This is a cleaner ready to perform. And then the preparation of different solution and different equipment for cleaning and disinfection. So this is the formula that we use for preparing the chlorine as per concentration that we require. And then we have to prepare those solutions based on the formula and the required chlorine concentration. And then after the cleaning, we remove the waste. Here we start cleaning, we remove the waste, we remove the linen as appropriate as possible, and then we check if there are sharps. After removing all the waste and linen, then we go for cleaning. When we come to cleaning, because we use the cleaning and disinfection, because we use that 2 steps, it is advised to use more buckets, like 1 bucket per task. And here they have summarized like 4 bucket system, where we have in the first bucket water and soap, and then you have the second bucket clean water, and then we have the third bucket chlorine 0.5 in most of the situation for environmental cleaning in the isolation, and then you have the clean water in the 4th bucket. So these are the steps. The first one we have said is cleaning with water and soap, and we must have enough cleaning clothes so that we do not need to go back into the solution, so that we do not destroy the solution or water that we need to rinse those clothes. So after we put the cloth in the soap and water, we clean, then we rinse in clean water, and the area we have cleaned is the time we put the disinfectant. Don't put disinfectant on an area where we have organic material, because it is a waste of disinfectant and it is not going to work. So this system allows to avoid the contamination of the solution. Anyone have question? I hear some voice.
Yes, yes. Can you please go back on the formula? I don't understand in a way. Okay, yeah. I was going to watch. I don't want. Okay, thank you. You can continue.
You got it?
Yes,
Thank you.
You can continue.
So then after, these are the steps to clean, and then we disinfect. After disinfection, remember that chlorine can destroy different metal equipment. It must be removed. We have to rinse and remove the disinfectant solution. After the exposure time, as I have said, in most of the situation is 10 to 15 minutes. If you go beyond, some of the equipment are going to be destroyed. And then we have to let the surface air dry. Then the last step, which is most of the time forgotten, is the cleaning and the contamination of the equipment we have used for this cleaning and disinfection of the room or the area where we were cleaning. So how to clean or remove body fluid from the patient? We have to keep the container covered if possible. For example, if they have those bucket where they can vomit in or urine, we have to empty the content into the latrine, clean with soap and water, then apply chlorine solution 0.5 for 10 to 15 minutes, and then rinse, dispose of wastewater from the container in the latrine, and then allow to dry. So here it is for utensils used for the patient food. So we use them we decontaminate them with 0.05 for 30 minutes rather than 10 minutes as we were used for other 0.5 concentration. But the procedure is still the same: clean and then disinfect and then rinse. For latrine, if the surface contains visible body fluid, use the procedure for surface containing body fluid. As we have said, that clean with water and soap, and then decontaminate with 0.5 for 10 minutes, and then rinse, and then let it to dry. So this is the clothes of the patient or the linen management. You have to place the soiled linen in a clearly labeled leak-proof container at the point of release. So the plastic bag, if it is unused, must be at the area of generation. And then close the container and then disinfect the outside of the container, and then transport the linen into the laundry for washing. This linen should be in red biohazard bags so that the laundry personnel are notified ahead so that they are going to receive linen from isolation. So the dirty laundry, we empty them into a drum containing water. They prefer to use hot but not that too hot with soap, and soak it completely in water and wash them well. After that is when we apply the disinfectant for 0.05 for 30 minutes. And then we remove the clothes, and then we rinse, and then we let them to dry. So here it is for the spill. No, for the usable PPEs. Because I've seen that we have boots, we have heavy duty gloves, we have aprons, goggles, which are reusable. So we have to remove body fluid by washing them with soap and water. We soak them in 0.5 chlorinated water for 10 minutes, and then we rinse, then we hang out to air dry or sun dry. And then the chlorinated water we use to clean them, we have to put in a latrine. We have to check those reusable PPE if they are still intact before using them. So disposal of contaminated item. So all those contaminated items that must be destroyed, they should be incinerated. Using of burn pits is for short period of time. Otherwise, it is advisable to incinerate those items. Remember, sharp items must be in puncture-proof containers before being taken to the disposal area. So then after, we have to remove the PPE. This was different step for cleaning environment. How frequent can we clean? Because sometimes someone may clean in the morning and then leave for 3 days without coming back to clean. These are some recommendations at the frequency of cleaning of different area of the case management for the Marburg, including the screening and the triage. In most of the situation, we should clean twice a day and when necessary. For example, when there is spill, when there is dirty, or when a positive or suspect case is removed, we have to clean and disinfect. Here it is for body fluid. What I want to highlight here before body fluid spills, what I want to highlight mostly is the 2 steps. We don't have to pour the disinfectant into the spill. We have first to remove the spill, and then we have to apply on people the chlorine. So how do we handle linen? It has been discussed before in the environmental cleaning, but we have to remember that linen contain body fluid and they can be a source of contamination Therefore, they must be handled with PPE and precaution. So the first step is to correct them and remove them in the area. So we have to put PPE for cleaners. If the linen are heavily soiled in some instance, they recommend better to incinerate them. But if they are not heavily contaminated, place those linen in a leak-proof container. And then after closing it, you disinfect the container with 0.5 chlorine, and then we transport them in the laundry where they are going to clean them. So if they are heavily contaminated with blood or body fluid, they can be put also in the leak-proof container and sent to incineration. However, if they must necessarily be disinfected, it must be treated as highly infectious linen using high precaution. So the second step after correction, it is disinfection. We take the soiled linen, we put them in the drum with hot water, soap, and then we wash them appropriately. After cleaning and rinsing, we put in the 0.05 chlorine for 30 minutes, and then we rinse, and then we let them to dry. After that, we clean the transportation container as well as the container we used for washing those linen. For waste management, we have 5 steps. Waste segregation, we have the collection of the waste, transport of the waste, storage, and waste treatment, as well as disposal. Waste segregation, we insist, though all the waste that are generated in isolation are considered biohazard or infectious, they must be incinerated, but we still need to do segregation because we have to put the sharp waste into sharp container appropriately, and then you have to put non-sharp waste into non-sharp as recommended. And another reason for waste segregation in healthcare facility is because 85% of the waste generated in the healthcare setting are non-infectious if we come to the routine practices. So it is heavily advised that we do segregate the waste so that the disposer is not burdened. So these are different category of waste we generate at the facility. We have what we call general waste. We have highly infectious waste, like the waste coming from isolation. We have just isolation for those highly infectious diseases like Marburg, Ebola, or the one we call biohazard level 4. And then we have infectious waste coming from the patient care, like the waste generated during patient care. And then we have sharps. And then, as I've said, 85% of the waste are general waste, which do not require incineration. They can be treated otherwise. But highly infectious and sharp, they must be incinerated. So waste segregation, then it is a very important step, and it must be done at the area of generation. It is the task of everyone generating a waste to know where to put that waste. So the separation should be maintained during collection, transport, and storage, especially for sharps, because sometimes at the level of generation, they are segregated, but the time they are transporting and storing, they put again together, which is not a good practice. And that's where it helps in terms of the treatment of those waste. Once we have combined general waste with infectious waste, they all become infectious. However, another mechanism to reduce the waste is to minimize generation of waste. For example, if we are collecting like equipment for the patient, we may remove the containers of those equipment outside of the red zone and then go with the item itself. In emergency situation, it is strongly recommended that all waste be considered as hazardous waste and stored in suitable containers. All waste from isolation are considered infectious, therefore they must be treated as so. At the level of collection, as I have mentioned, once the waste are segregated at the area of generation, they must not be put together the time of collection. We have to keep the segregation, and we must collect those waste regularly at the area of isolation and schedule the time of destruction or treatment of those waste. Waste collection staff should be made aware of sharp bins that have been closed by care staff. All solid non-sharp infectious waste should be collected in a waste bag covered bins, in the covered bins, and those waste bags must be read with a mark of biohazard. We must have PPE and use them appropriately. Transport of those waste must follow also the appropriate IPC measures. Specifically, we have to transport them in a manner that they are not going to be left behind along the way of transport, but also the personnel transporting those waste must wear PPE. The means of transport, we have to check the ones which are not going to cause hazard to the handler, but they must be easy to load and unload. They must not have sharp edges that can cause trauma or tear to the bag or to the one who is transporting the waste. And that item used to transport waste must be easily cleanable and disinfectable. Tolerating chlorine, because this is the solution we are using for disinfection. That carrier must be identified according to the waste type, and the route must be planned to avoid the exposure to other people in the facility. The storage, it is normally advised that the waste generated from isolation should be treated or incinerated the time they are released. Otherwise, if it is not possible, we can keep them. The maximum is 48 during the dry season, while when it is rainy season, we can go only 24 hours. But the place must be a protected place with fences away from reach from like children or animals that can go in and then bring back those waste. That's why we prefer to incinerate those waste. The time they are coming from isolation, you have to notify the incinerator people to immediately treat them. We don't have to put infectious waste in open and public places, so that we have put effort in protecting people. Now the waste are at the public area, so we have to be careful at the area we put those waste. The storage area must be a closed area with access limited to authorized personnel only, must be separated from food stuff, because food stuff call for the predators, animals. It must be covered and protected from the sun. It must be on an impermeable soil so that we can allow the cleaning and the drainage of the area. The area must be easily cleanable, protected from rodents, birds, and other animals, have easy access to internal and external transport if the waste are not treated at the facility. It must be well ventilated and well lit, enough light, compartmentalized, divided accordingly to the type of waste, and then in the vicinity of incinerator so that it allow easy access, equipped with wash basin or hand wash facility, and must be marked no entry, toxic material, or infectious risk, because it is an area for waste. After that, we have to treat those waste. We have said that the incineration is the ideal method for elimination of those waste coming from isolation. In some situations, we can use burn pit, but it is an emergency way of disposal of this waste. Otherwise, incineration must be used. because it is not a good method, the burn pit, because it causes air pollution. So we have other guidelines regarding to management of Marburg cases. For example, this is an interim guidance that has been released by WHO for safe handling and dignified burial of patients who have died from suspected or confirmed Ebola or Marburg virus. They highlight different steps that must be followed the time we are handling dead body, and it is freely accessible to WHO website. I put the link below. So I thank you for your attention, and these are the key message. Ebola virus, they can cause potentially highly fatal disease. The several body fluid can transmit Marburg, but blood is the most infectious body fluid due to high viral load. Human-to-human transmission occurs via direct and indirect contact, and communicability period start on the day of symptoms until the day we have seen two negative PCR and the resolution of symptoms. Screening, I repeat again, screening is critical to prevent entry of patients with potential Marburg disease into the health facility. That's why we have to strengthen that practice in our setting. And IPC measures must be applied based on the type of activity being conducted and based on the risk of exposure anticipated. It is important to have a buddy when we are donning and doffing the PPEs. We know that the removal of PPE in an appropriate way is the high risk moment of possible contamination for healthcare workers. That's why we need to be careful, and then we must train people to put the PPE appropriately and to remove them appropriately. Ebola virus and Marburg can survive on surface until 16 days. That's why we need to clean and decontaminate the surface where we are working. Ebola virus is susceptible to disinfectant, but it is important that organic material are removed. That's why we have to clean first, then we disinfect, because we have separate disinfection product and cleaning product. 0.5 chlorine solution are effective for surface disinfection, and regular cleaning and disinfection of surfaces is effective and will significantly reduce risk of transmission. And remember, do not spray, because it is toxic than helping us to reduce the risk. So I thank you for your attention. I welcome the question, comment, and addition so that we can take care of ourselves, but also of the population we are responsible for. Thank you.
Thank you, Dr. Marie-Claire, for the good presentation. So I see some questions. I can start to ask some. I don't know if Bruce, you are still here. Okay, let's start. Diane, can you ask your question?
Thank you for the good presentation. I want to ask you a question. In the starting of the presentation, there is one slide said that in the semen, the virus can persist like 284 days, if I remember well. So I want to ask you that, what about the woman who have that virus during when she breastfeeding, she have a baby? How about how the days can persist in the breast milk? That's my question. Thank you.
Thank you, Diane, for the question. I need to read about the literature I went through. There were no days mentioned, but I have to check, or if anyone in the group may have a updated data may share, but so far I have to check more literature.
Thank you.
Okay. Anyone who has a question? Diane, do you still have a question?
Yes, I still have another question. There's one slide that said that in a dry blood, the virus can persist about 16 days. How about when someone having this virus and touching somewhere? Let's say he or she touch on the table, on the door. How long it can persist when someone touch somewhere? Thank you.
We can consider the same 16 days because it will be considered as a dry space, a dry area contaminated. If it is not cleaned and disinfected, we can consider the same 16 days.
Thank you.
Okay. Felix, do you have a question? Yes.
Yes, I have a, but it's not like a question, it is a suggestion. So thank you for nice presentation and the good knowledge from you. So I would like to give you a suggestion. Here I'm working in a district hospital. The IPCs from district hospital have those responsibilities as additional. So we can't pass 5 years without any outbreak. So I wanted to to know which strategies do you use, or how you can reinforce the IPC in district hospitals, because the ones who working on this position are working on that position as additional responsibilities. It means we can't have a time to monitor or relate the two IPCs. Thank you.
Okay. Thank you for raising this question. So, someone is speaking.
No, I was saying what we are suggesting as IPC organization. First is the advocacy to have strong structure for IPC at all level of healthcare system. Because you find, as you mentioned, we have many outbreaks. Almost every year we have an outbreak. Therefore, we are advocating that we should have dedicated IPC focal person or officers who are assigned for IPC activities because they require time, knowledge, and like the responsibilities for the one who is performing or responsible for that. So our role is advocacy to the Ministry of Health and possible support from the other supporters of the government. However, if you have some directors of hospital, they can tell us what they are doing to strengthen IPC in their facilities. Thank you.
Yeah, thank you.
Okay. If there is no question, so Kelly, can you stop your sharing the screen? And then Can you switch on your video so that we can take a picture? So please put on your screen and then take a picture for today. So thank you so much. We will meet again in our next session. See you then. Thank you.
Thank you.
Thank you
Thank
too.
Thank you.
Thank you very much.